Okay, Diana, we're recording now, and are you okay with me recording you and you on video with camera on and your name's on the screen as well? Is that okay?
Yes.
Okay. All right, so we're going to cover two things. One of them is going to be in that worksheet for the blood vessels, the umbilical cord, the fetal circulation. So we'll get a little bit of information about that, and then Circle of Willis, right?
Okay.
Okay. All right, so let's take a look at this. I'm going to start out with this picture, and this is down at the end of your identification, and I think this is going to help you identify what it is that we're looking for. Now, if we were in lab, obviously it'd be much different because you would have your hands on this. So I think this is going to help you be able to see what's going on. So this is a model that over here on the top left-hand side, this is the placenta, and this is where the umbilical cord is going to come off the placenta, and then it's going to come into baby at umbilicus. So what we're looking at in this picture, of course, fetus is here, and then you can see in the fetus that we have the ability to take off this chest wall where his little ribs are, and then also the abdominal wall here. And then when we take this off and flip it over, we can see the inside of this umbilical cord as if it were coming inside of the fetus. Okay, so the pictures for S and T, what we're identifying are vessels here that are on the inside of that chest plate. So if I go back and look at this again, imagine picking this up with your hand and then flipping it over and looking at the inside of this chest plate. So here you're going to see ribs, and then here's the abdominal wall. So these are the rectus abdominis muscles and then transversus abdominis. Right here's belly button, and again, there's that umbilical cord. So the umbilical cord is going to the belly of the fetus, and then when that cord comes in, it's bringing blood in through one vessel and it's taking blood out through another. So I'm going to go back down to the umbilical cord, and when we take a look at the umbilical cord, just like vessels that come into the heart, those are called veins because they have the word I-N in the word vein, V-E-I-N. So vein means in. So the umbilical vein is going to bring blood in to this baby. And just like at the heart, vessels that start with an A are arteries, and A for artery means away. So any vessel that leaves or goes away from the heart is an artery. So the same thing is going to be true from this fetus. The vessels that come away from this fetus are going to be arteries. There's one vein, one umbilical vein coming in, and there's two umbilical arteries going away. The veins coming in are carrying oxygenated blood because you want to take oxygen to the baby. So veins go in carrying oxygenated blood, one vein. And then two arteries carry deox blood away. Arteries go away from that baby. So when we see the umbilical cord here that's coming in, this is where the vessels split. There's one umbilical vein that's red in color, and it's coming into the baby, bringing oxygen. There are two umbilical arteries, and these arteries are coming away from the baby, and they are carrying deoxygenated blood. So I think a picture that may help with this to kind of figure out, okay, then what happens after oxygenated blood comes in and deoxygenated blood goes away? Like what else is happening in there? I just Google image stuff all the time. And this is probably one of my favorite pictures that helps describe fetal circulation. What I Googled for this was the word Pearson, P-E-A-R-S-O-N. That's the book that we used to use, and I think they have the best description of it. So this is a fetus on the left-hand side, and then this is a newborn. So here we can see the fetus because the umbilical cord is still attached to the placenta. And then on the right-hand side, this is a newborn or a child or a teenager or an adult because we have cut the umbilical cord and we don't have the same vessels going in. So I like it because it compares fetal circulation to what you're very familiar with as the adult, for example. So let's start with the placenta here. And remember, placenta's job is to bring oxygenated blood into the baby. And because we're coming in, we're going to come in through a vein. So the vein's going to be red in color, carrying oxygenated blood. And this is what we were looking at in that picture right here. We've got one vein coming in, and then we've got two umbilical arteries that are going to be going out. So again, when you look at this umbilical cord, there's one umbilical vein and two umbilical arteries. And the two umbilical arteries wrap themselves around that vein, and that's what makes up the cord in and of itself. So again, bringing in oxygen through the umbilical vein goes in, and this umbilical vein is going to go up to the liver. And the umbilical vein is going to turn into what we call the ductus venosus. Now, we don't have this ductus venosus in the adult because after we cut this umbilical cord, this umbilical vein, which became the ductus venosus, it's going to dry up and shrivel up and turn into what we're going to call a ligament, ligamentum venosum. So adults have this ligament, and when we study the liver, you're going to see this ligament hanging off of the liver, and that is a remnant of a blood vessel that used to be in the fetal circulation. So in the fetus, we call it ductus venosus. And a ductus, duct like ductwork in your house that the air runs through, that's a tunnel or a tube. So that's an open tube, and it's a vein. Remember, umbilical vein, so it's a venosus. It just means an open vein, literally is what it means. When we cut that umbilical cord and that ductus venosus dries up, it turns into a ligament, and so we just name it ligamentum venosum. Okay. Now, what's going to happen is we're running this freshly oxygenated blood into the baby through the liver first, and then it's going to go into the inferior vena cava. So umbilical vein, ductus venosus, and then we'll go into the inferior vena cava so that we can go into heart.
Okay.
Okay, do you have any questions about that so far, Diana, as far as traveling or veins or oxygen, anything like that?
Mm-mm.
Okay.
No,
So the next, go ahead. You good?
Yeah, just when it then mixes and when it's purple and.
Yes, right. So, you know, remember that this fetal circulation in here is, it's never 100% just oxygen, and it's never 100% deox. So you're going to be mixing this freshly oxygenated blood with deox blood, and that's where we get this purple color. So this is where the deox blood is coming back from like baby's toes. You can see we're coming up from the legs, up from the abdomen. So here we're mixing fresh oxygen from the placenta with deoxygenated blood from the rest of the baby. That's why we get that little purple.
So after it leaves the toes, it doesn't all go out into the placenta. Some of it goes back up into
It does not, yeah. So if it's little toes, we're down here, and we were coming up from like toes and feet and ankle and knees and thigh, and we got up into the pubic area and then into the abdomen, then we're coming back up to the heart. And we would do this circulation then, you know, through the heart. We're going to try to bypass the lungs. So we'll do that. I think at another, have we already done, I can't even remember, have we done fetal circulation in the heart?
No.
Okay. So when we talk about fetal circulation in the heart, we're going to try to bypass the lungs because obviously fetus is not breathing oxygen, right? So we're not picking up oxygen through the lungs. But we're going to circle through the heart, and then we're going to come back down the aorta. And then we're delivering that now mixed blood to the fetus. And this is actually where we're going to bring out the umbilical arteries. So go ahead and add that now. But the circulation, you're right, it doesn't come up from their feet and then go out of the placenta. It comes up from their feet, mixes with the oxygenated blood, goes through heart circulation, goes back out to the body, And then at some point, some of that blood, as we go descending aorta, and then we go into the common iliacs, the common iliacs will split into external iliac and internal iliac. Now, it's the umbilical arteries that are coming off of this internal iliac. So here's common iliac, external iliac, internal iliac. Umbilical arteries are coming off of that internal iliac artery. So there's one on the left and one on the right. This is actually your urinary bladder. And they go up underneath the bladder, and then they come out right here at umbilicus, at belly button. So that's one way that you can remember there are two arteries going away carrying deox blood, is because the umbilical arteries, the two umbilical arteries, have to come off of the two internal iliac arteries, one on each side and up underneath the urinary bladder and then out to the umbilical cord. Now again, when we come over here to the newborn and we cut that umbilical cord, there is no more circulation happening. So in the adult, we have a descending aorta, we have a common iliac, we have an internal iliac that's going to the bladder itself, and the same vessels went to the bladder itself here. But when we cut that umbilical cord, what used to be the umbilical arteries going away carrying deox blood, they also dried up into ligaments. So here on the fetus, we see that these are called umbilical arteries going away. There are two of them. But when we cut the umbilical cord, again, those arteries turn into ligaments. They shrivel up and no longer carry any blood. They just turn into a piece of tight tissue. So those are going to be called medial umbilical ligaments. So as an adult, these are umbilical ligaments. These ligaments actually go from our belly button and go underneath our urinary bladder, and they connect to that common iliac. They don't have a function anymore, but it may be the case that if you've ever, and it just depends. This is one of those things that depends on people's anatomy. But some people, like when you're washing your belly button in the shower, you can actually feel movement underneath the urinary bladder. It's like this real strange feeling, and it's because there's a ligament, two ligaments that are connecting your belly button up underneath your bladder right here. I've mentioned that before in class, and some people look at me like I'm crazy, like, what? And I'm like, well, just get in there and dig your belly button, see if you feel anything down low like that. So, I don't know. Some people are like, no, I've never felt that. And maybe they just don't want to admit it. I don't know.
Never
But anyway,
knew.
that's your umbilical arteries.
Okay, so I'm still, when the question is like which vessels carry oxygenated blood and which vessels carry deoxygenated blood, I get the umbilical vein and the umbilical artery.
Yeah.
But then it seems like once it's inside the body, then it's a mixture.
It is. And we would never go through then and say, okay, at the superior part of the inferior vena cava, is that oxygenated or deoxygenated blood? Because the answer is yes. The answer is both.
Okay.
So what we're looking for our purposes, is to know that umbilical veins coming in carry oxygen, and umbilical arteries going away carry deoxygenated blood. So those are the two that we're looking for in a question like that for fetal circulation.
Okay. And where the umbilical arteries go, besides the placenta, is the umbilical cord. I guess the umbilical cord arteries are in the cord.
They are.
That's not like like if it's asking where's the blood flowing. So the next place would be the placenta.
That's right.
Okay.
So the next place is the placenta. So the umbilical arteries are coming out of the umbilicus, the belly button, and they are wrapping around the umbilical vein, and that's what actually makes your umbilical cord. And then they are traveling to the placenta, and then that's where the exchange of blood is going to happen between mom and baby. So now mom's carrying that deox blood from her uterus, and will carry that then back into her circulation to be able to dump off the carbon dioxide for the baby.
Okay.
Mm-hmm.
And then the shunts, the different ductus, arteriosus, to the venosus we talked about, and the foramen ovale.
Yeah.
It's like some goes through there, but not all.
Yeah, so that's more in fetal circulation of the heart. So these two that we just went over, we're talking about moving blood to and from the placenta and then to and from the baby. And then when we get up to fetal circulation, that's where we're also going to bring in more shunts, which turn into ligaments, and more openings. So let me see if I can get, let's do fetal heart circulation. Fetal heart versus adult. Let's see if we can see both of them. This might be a good one. Okay, yeah, this looks like a good one. Okay, so on the left is fetal heart, and then on the right is going to be newborn heart, which would also be your adult heart. So if we were down here, if we were thinking about the liver being right here, and we brought right where, can you see my mouse, my pointer of my mouse?
Mm-hmm.
Okay.
Yeah.
So if we brought blood in from the umbilical cord, we're coming in through the umbilical vein, VEIN, carrying blood in, oxygenated blood, and then we're going into the liver through the ductus venosus. And from the ductus venosus, we're dumping into the inferior vena cava. So we're at inferior vena cava, and inferior vena cava is going to travel up and get us into the right atrium. From right atrium, we know that we go to right ventricle. From right ventricle, then we're going to go out through the pulmonary trunk to the pulmonary arteries and then to the lungs. Now, if you think about in a fetus, there's really no point in us sending this blood to the lungs because the fetus is not breathing oxygen and the lungs are not picking up any oxygen, and we're not going to be dumping off any carbon dioxide. So there's actually two bypasses that we can try to prevent this blood from going into the lungs. Lungs are the last thing to develop, and we don't want to put a lot of pressure on the lungs. We don't want to force a lot of blood through the lungs because we can damage lungs, right, in this little fetus. So we've got two backup plans. And the whole idea, if you think about this fetal circulation, is I want to try to prevent the blood from going to the lungs. So the first opportunity that we're going to have is when we come up from inferior vena cava and we come down from superior vena cava and we come from the coronary sinus, the circulation of the heart, and we're in the right atrium. We know that normal flow in the adult is to go from right atrium to right ventricle. But if you're in right ventricle, the next place you're going to go is pulmonary trunk and pulmonary arteries to the lungs. And so we really don't want blood to go to the right ventricle. So we have a hole. We have a hole in the wall that's in between the right ventricle and the left ventricle. And that hole is called foramen, which means hole, and ovale, which means oval. So there is this oval hole that's in the wall between the right atrium and the left atrium. This opening, this atrium and this atrium, they touch each other. They're like two rooms. So they have a wall in between them. It's just that we've got all these big vessels that are, just like when you dissected your, heart. So in the fetus, this foramen ovale is open so that when blood goes into the right atrium, it can go straight over to the left atrium and then left ventricle and then aorta and then out to the rest of the body. And that's a good plan. because what that does is it prevents blood from being allowed to go to right ventricle, pulmonary trunk, pulmonary arteries, and lungs. So that's normal, foramen ovale. Now, after we cut that umbilical cord and baby takes his first breath, that first breath, that expansion of the lungs, there's a chemical reaction, a chemical release, and that foramen ovale closes. Instead of being a foramen, we call it a fossa. A fossa is just like a bowl-like depression. So instead of it being an open foramen, it's now going to be called a fossa. And we keep its last name, we call it ovalis. So that's the fossa ovalis that we're learning in the adult heart. It used to be an open hole. It used to be a shunt or a bypass from right atrium to left atrium. Several times you hear about babies being born with a hole in their heart, and we all get like, oh, baby's got a hole in its heart. Well, all of them had the hole in their heart. The problem was that hole didn't close up.
Oh, okay.
So that's kind of it's kind of an interesting, you know, like when you know the anatomy behind it and you hear the hole in the heart, you know, it used to require surgery for them to go in and put a mesh in there, but they now have medication that causes that chemical reaction to close that up if it didn't close on its own. So it's a much better way of doing that instead of doing an open heart surgery for a newborn. So that's our first shunt. It's called foramen ovale. It turns into the fossa ovalis in our adult. Now, let's just say, of course, not 100% of the blood is going to go through the foramen ovale and be shunted from right atrium to left atrium. Some of it is going to go into right ventricle, no doubt. And some of it is going to go up into the pulmonary trunk, but we still have a second bypass. We still have a second shunt or a second way to keep blood from going out the pulmonary arteries into the trunks, into the lungs. And that second one is going to be if and when blood does go from right atrium, because it didn't go through the foramen ovale to the left atrium, right ventricle, pulmonary trunk, right here at the T, at the split, where you go pulmonary trunk, and then you go left pulmonary artery and right pulmonary artery, there's an opening between the pulmonary trunk and the aorta. And that opening is called ductus arteriosus. Ductus, again, meaning opening or tunnel or tube, but this time it's an opening of an artery. Remember, ductus venosus was the open vein from the umbilical cord. This is the ductus arteriosus because this is the pulmonary artery, pulmonary trunk, and this is the aorta, which is also an artery. So this is a duct or an opening or a tube or a tunnel between those two major arteries. By allowing the blood that went from right atrium to right ventricle to pulmonary trunk into the aorta, then it would go down the aorta rather than go into the lungs. So that's your second, I call that like plan B.
Okay.
That's your plan B there, in case blood did not go through the foramen ovale, but did actually make it into the right ventricle. Now, as an adult, when baby takes a breath, then that ductus arteriosus is going to close up because we no longer need or want the blood to bypass the lungs. Now we want to close up that opening, and that's when we would call it the ligamentum arteriosum. So just like before, when we turned the ductus venosus into the ligamentum venosum, we're going to turn the ductus arteriosus into a ligamentum arteriosus in the adult.
Okay.
So that's after we cut umbilical cord. Again, so if we look at ligamentum arteriosum in the adult heart, here it's colored in green, so you could see right ventricle here, pulmonary trunk, pulmonary arteries, and that little ligament that's holding the pulmonary trunk to the aorta, that's your ligamentum arteriosum. That used to be the ductus arteriosum. It used to be an open pathway. So there's that little piece right there. So in the adult, It's just a piece of ligament that holds those two arteries together, and you kind of think, oh, that's just a little structural thing. Right atrium, right ventricle, pulmonary trunk, but it used to be open so that blood would go straight into the aorta. Anytime I'm looking at structures, I love to just do stuff like this, like go through Google image and kind of identify it over and over and over again, and it just solidifies where it is. So if I just go through and put something in there like ligamentum arteriosum, and then I know exactly where to look for it between the pulmonary trunk and the arch of the aorta, even if it's something somebody drew like right there. Okay, did that help with that one?
Yeah.
Okay.
A lot.
Okay, so we get out of the fetal kind of stuff, and then anastomosis was the next thing that you wanted to take a look at.
Yeah.
When we look at the word anastomosis, so we're going to talk about Circle of Willis with this a little bit. Let me see what my, do you see just a whiteboard on your screen now?
Mm-hmm.
Okay. So to make it just as simple as I can make it, and I'll show you pictures, but just, just using the language that we use and what we've done so far. We are going to be talking about, this is a new drawing board for me, so I'm learning. It feels so weird. This is my Circle of Willis. It is just a circle named by an English physician named Willis. That's why he got his name on it. So that's it. That's all it means, just named for a doctor. But when we think about the Circle of Willis, what we know, I'm going to show you a couple pictures I think are going to bring all this together. But this is actually going to be circling the pituitary gland. And we're moving into endocrine system, and we're going to see how important pituitary gland is and just how vascular it is and how much blood goes to it. But we're thinking about, I'll kind of draw some different views for you, but we're thinking about looking at the brain upside down. So you have to kind of think about, what did the skull look like when I took the skull cap off and I thought about the sphenoid bone that had the sella turcica where the pituitary gland sat in there. So this is going to be blood circulation at the base of the brain, and that's what the Circle of Willis is. So this is my Circle of Willis, and it is this, it's just a circle. An anastomosis is where you have two vessels that run into each other. So when you look at a circle like this, the blood's not just going to go like clockwise direction or counterclockwise direction. You're going to have blood coming in from here, and blood coming in from here, and blood coming in from here, and blood coming in from here. An anastomosis is basically where blood just bumps, where blood, if it were coming in two different directions, it would just hit head on with more blood. So if we had a vessel and blood was coming from this direction, and we had another vessel and blood was coming from this direction, then no matter what happens, there's still going to be the ability for everything around that area to receive blood. So let's just say some big block happened right here. I don't know, maybe we got this huge piece of plaque, and this vessel got completely clogged, and there was no more blood coming in from this side. That's no problem. There's blood coming in from this side, and that's called an anastomosis.
Okay.
We actually saw this a lot in the heart. So here's my heart, like this. And we saw blood coming from this side. This is outside the heart. Blood coming from this side, and then blood coming down the front of the heart like this. So where blood came in two opposite directions but came together, that's called an anastomosis right there. All of this blood down here is supplying all of this heart muscle. So if you kind of think of it, if you had your heart like this, and you had blood coming this way and then down, and then blood coming this way and then down, if this gets clogged up with plaque, all of this heart muscle is going to die.
Mm.
But if we have that same idea with blood coming this way, blood coming this way, they basically run into each other. That's called an anastomosis, and then they go down together. If we get this big clot over here, it's okay. This heart muscle down here is still going to get blood supply because it's coming from the other side. So you'll see that in areas where it's just the most important that the tissue in that space get blood. So base of the brain, a lot of anastomoses. Around the heart, a lot of anastomoses. And you'll see that word kind of over and over again, but it's just basically where blood vessels merge and bring blood in. So with this circle of Willis, because it's a circle, there's blood coming in here, and blood coming in here, and blood coming in here, and blood coming in here. The major contributors to the circle of Willis that we need to know is going to be blood coming in from the side, and that's going to be our left internal carotid. And then, of course, blood coming in from the side over here, right internal carotid. And these are arteries. Circle of Willis is an artery, so it does have oxygenated blood coming away from the heart. And then coming up from the base of the brain is going to be that basilar. There's that word base, basilar artery. And the way we got to the basilar artery was that we had two vertebral arteries. So we had a left vertebral artery and we had a right vertebral artery. So
which ones are actually considered anastomoses? So I understand the circle of Willis being considered an anastomose.
It is, right. Just anytime there's more than, anytime there's blood coming to a vessel from more than one direction, that's the anastomoses. And it's just a description of it. You know, like, so if you're driving and we're coming up to like a four-way stop this way, and, you know, we just say, okay, that's the four-way stop. It's just because there's four directions, four cars coming up to that. But we kind of just call this junction or area a four-way stop. And because there's blood coming into this same circle, and this is the circle of Willis, is just a bunch of vessels that blood's coming in from all different directions. And there are way more arteries bringing blood into this circle of Willis, but we're only responsible for three: left internal carotid, right internal carotid, and basilar. But we do have to know that the vertebrals merge together to form the basilar. But there's more blood coming in the front, kind of in the backside like that. That whole thing is called an anastomosis. And it's just a description of, a four-way stop is a description where four roads come together, and anastomosis is a description where blood comes from two different directions, two or more directions to a common vessel.
So on our worksheet for our blood vessels worksheet, it says which arteries listed for question 12 are anastomoses. So we have ascending aorta, aortic arch to the brachiocephalic trunk, to the right subclavian artery, to the right vertebral artery, to the basilar artery, to the circle of Willis. So the circle of Willis is the anastomoses. That's where all the blood is coming in.
Yeah.
But then one of those other ones also considered an anastomoses?
Read it to me again. I don't remember the question, Diana.
You have, it says there's two options. There's two answers. It says which arteries listed for question 12 are anastomoses, and it says blank and blank.
Okay. And
question 12 was tracing the pathway that the clot may have used to get to the circle of Willis using arteries from questions 10 to 11, which was which arteries join the Circle of Willis. So if you want to back up to question 10, says 2 other arteries also join the Circle of Willis, and that should have been the vertebral arteries because it's talking about going through the transverse foramina of the cervical vertebra up to the foramen magnum. So that's the vertebral arteries.
Okay. Let me see. Okay, so when we're tracing the pathway the clot used to get to the Circle of Willis, then we've got ascending aorta, aortic arch, brachiocephalic trunk, right subclavian, right vertebral, basilar, and the Circle of Willis. Is that what we have?
Mm-hmm.
Okay.
Yeah.
Okay, so which arteries listed are anastomoses? So we know the Circle of Willis is. Basilar is also an anastomoses because here's what happens. This is right vertebral. This is left vertebral artery, right vertebral artery. And then we've got this basilar artery right here. And it's getting blood in from 2 different directions. So again, when we look at the joining of where vessels come in, we'll call that an anastomoses. I kept doing up here going like it's coming from 2 opposite directions. It doesn't necessarily have to come from 2 opposite directions. So that was probably my fault in describing like how it comes in. An anastomoses is where you're going to have a joining of two directions of blood. So again, if this is basilar right here, this is going to be considered an anastomoses as well. Think about everything that the basilar is going to be supplying. If we get this really big clot right here in left vertebral artery, then everything right here is still going to get blood because we're going to bringing blood up from the right vertebral artery. So maybe merging is a better word for anastomosis to describe.
But then wouldn't the aorta also the aortic arch? I mean,
so with the aortic arch, so you've got blood coming up from left ventricle into the aorta, and then it can go out brachiocephalic or common or subclavian, right? So
okay, so it's only getting the blood from one
area.
The,
Now, when you talk veins, you're going to have so many anastomoses because think about even coming up from like femoral, right? And the common in your iliacs,
yeah,
to internal. So we actually use that word a lot more when we talk about veins because they merge in
okay.
to one another. You do still see anastomoses in arteries, not as frequently as you do in veins. More often than not, you'll see that term. It's almost just like where 2 veins running together. And then the capillaries, where you have like a true capillary and then branches that come off and then they branch back in. It looks like these vessels like run into each other. So on that answer, basilar is an anastomoses because it has blood source from 2 different places merging in together, and then so is your circle.
Okay.
And then let me go back to see. Let's see. Okay. Are we back to where you can see my like Google search?
Mm-hmm.
Okay. I'm just going to put in internal carotid artery. And just show you a couple of these images. This is probably one of my favorites, but I want to come back to it. Do I want to come back to it? Let me look. No, I think we could do this now. Okay. This is probably one of my favorite images. I'm sure they're gonna make us buy something probably. I'm just trying to learn. Okay. Of course, you see eye socket, nose and teeth and sinuses, occipital bone sitting on the first cervical vertebra, second cervical vertebra. And then coming up here, you can see sella turcica of the sphenoid bone. And then right there is where that pituitary gland would be sitting. Does that all that ring a bell?
Yeah. Mm-hmm.
Okay. So the reason I like this picture so much is because when we're talking about the Circle of Willis, we're talking about this area right here, all around this pituitary gland. And so your vertebral arteries come up in those holes in the cervical vertebra. One of the things we learned about cervical vertebra is they were easy to identify because their transverse processes had those holes in them, whereas the thoracics and lumbars did not, and that was to carry the vertebral artery up the neck. So you can see I'm looking at the right vertebral artery, and back here kind of in the shadow is the left vertebral artery. And this now is going to be basilar artery where my two vertebrals come together. My basilar then is going to feed into this Circle of Willis right here. So this is an anastomoses because we're merging blood flow in from two different sources. So there's basilar. And then you see this kind of, I mean, it's not as obvious as probably what you think, like, oh, big Circle of Willis, but you know, there's blood coming in this direction. There's blood coming in right here. There's blood coming in right here. There's blood coming in right here. There's blood coming in right here and up here. All of this is just merging in together at this big circle.
Okay.
When we come down here, this is my common carotid, and it's going to split. This is my internal carotid coming up, going inside my skull. And you can see an opening. If you remember in the sphenoid bone, it had all of those openings, like the ophthalmic opening for the ophthalmic nerve to come out. This is an opening that we didn't name. We didn't have to learn it. But there were a bunch of holes around that sella turcica. This is my internal carotid, and it's also feeding into that same Circle of Willis. Down here with my common carotid, this is my external. And this is all going to go out to the external part of my skull. All of this goes to the outside of my skull. My internal carotid is going to the inside of my skull. When I get up here and look closer, this is basilar, where the two vertebrals came together. And then right here's where the pituitary would sit, and this is making that big circle. This is my internal carotid artery. Then on this picture, which is more common, this is the more common picture that we see of Circle of Willis. So now that you've been able to see it from a lateral view, this is the left vertebral artery coming up. This is the right vertebral artery coming up, making the basilar. And then the basilar is bringing blood up from kind of the underside, backside. That's the Circle of Willis. There's the pituitary gland. And this is my internal carotid on either side. And that makes up that Circle of Willis.
Okay.
Does that help a little bit for the, to be able to see all that?
Yeah, for sure.
Hey everyone, this is Nicole from
I have no idea what this video is. But it's
vascular anatomy of the brain has been a subject of study. It's 17th century brain. We'll be discussing the machine from the basal view. Hi guys, quizzes, join us.
Nah, they're trying to sell us on something. Okay.
So the actual arteries that we, for our purposes, that we are required to know that make up the Circle of Willis, you have the basilar and you have the internal carotid, right?
That's right. Yeah, that's right.
Right and a left internal.
Yeah. And so when you look at this, like there's so many more, there's a lot more to it. But what we know is we have two vertebral arteries that were coming up off our subclavians. They merge together to give us the basilar. Here's the circle.
Mm-hmm.
And then coming into that circular are the internal carotids. There's also this one, this one, this one, this one, this one, this one. We're not even going to like say all those names because it's just too much.
Got it.
But as you look at Circle of Willis, and again, we kind of just start, you just get again more familiar with it. Two vertebrals, basilar, two internal carotids, and then that's the circle.
Okay.
And there's not, that's that one picture that I had that showed the lateral view. To me, that's the one that always made sense because it's so difficult to imagine the brain being upside down. This one, you'd have to be pretty familiar with your vessels coming up this way. But these are going to be your vertebrals coming up. And then here's a vertebral coming up to the basilar. And that's going to hit the Circle of Willis there. And then here's a carotid coming up that's going to split into an internal and an external carotid, and that's the internals. So vertebral, basilar, and then Circle of Willis, and then here come internals. So again, you know, like I said, I just recommend flipping through and getting familiar with what some of the pictures look like, but that's it. Once you figure it out, it's like, okay, is that it? Now here's a really cool piece of jewelry. You want to ever consider doing that. Anyway, that's kind of a cool one because it shows you, again, the sella turcica and the pituitary and where the Circle of Willis is right there. Did that help?
Okay. Yeah, definitely clarified it for me. Thank you.
Yeah, you're welcome.
I'm a little confused between, because I'm like, aren't all vessels coming together? But that makes sense.
Yeah, so, you know, when we, all vessels eventually will, because you'll go artery, capillary, vein. So you do get that circle and they do, you know, merge in together like that. But the junction is more for the anastomosis where it looks like they're just running in together. And sometimes you look at it and it's like, well, where would it go from that point? You know, but I always kind of just look at it, it's like it's really good design backup plan, you know, because there's more than one, more than one source of blood coming in.
Yeah, that's
All
pretty
right.
interesting.
Well, I'm going to post this for folks and hope that it helps, you know, before all these workshops, I mean, all these worksheets are due. So thanks for spending so much time with me.
No problem. Thank you again. I appreciate it.
I'll talk to you soon.
All right.
Bye.